morning, everybody, and welcome to Great Day Houston. Question, what would you do if your pet had an emergency? They swallowed a bag of chocolate, they got injured, or they're really, really sick. At VEG ER, they make things as comfortable and as convenient as possible for both you and your pet. Let's go inside and find out how they do things a little differently while caring for people and pets when they need it most. Hi, Dakota.
Hi, Deborah. Welcome to VEG ER for Pets. Who do we have here?
Oh, this is Riot. Of course, you know that because I believe Riot is actually your
that's
puppy.
my boy.
Yeah.
Riot.
How did you come across Riot?
Yeah, so Riot was actually brought in by a Good Samaritan. They saw him on the side of the road limping. He'd probably been bumped by a vehicle. So they brought him here to get triaged, and we made sure he was stable. Whenever I showed up to work that day, I saw him and I was just like, oh, you're coming home with me.
Aww.
So, yeah, he was a stray, and now he's got a really nice, loving family.
Yeah, all right. One of the first things that happens when you go into typical ERs is they say, hi, do you have an appointment? That didn't happen here.
No, all we do is emergency, and we don't have time for appointments. So they can come on in and be seen by a doctor right away.
Yeah, because usually when an emergency happens, like it's not on our schedule anyway, right?
Not at all, right?
Yeah, all right. The other thing that oftentimes happens when you come in is that they'll say, okay, we're gonna take the pet away, and that creates a little bit of anxiety because you don't know what's happening.
It does, yes. We want to make sure that the owners are involved in their pet's care, and they get to see the experience we provide and the care that we provide, so we keep people and their pets together throughout the entire process.
Yeah, there's almost an open floor concept, and you immediately start assessing the situation.
Absolutely, yes. We have an entirely open floor concept. We still have 2 exam rooms for anybody who has a high anxiety pet, or maybe the owners just aren't comfortable with the open floor concept, but we utilize the open floor so they can see the care that we provide 100%.
Sometimes if something happens and someone feels like, oh, I don't know if my pet's gonna be okay or not, but they think, okay, it's nighttime or too early in the morning, or it's a holiday, so they'll think, I'll have to wait until an appropriate office hours. That's also not a problem here.
Nope, 24/7, 365, and they can always call and speak to a doctor right away too to have any concerns or medical questions answered by a veterinarian.
Yeah, because time is of the essence.
Yes, ma'am.
All right, Riot, thank you for letting me borrow you for a few minutes. Right now we're gonna go talk to Dr. Kale about the types of emergencies that come through and the type of care that doctors give here.
Amazing.
Bye, Riot. But Riot's with its owner. He's like, okay, bye, lady, leave me alone. Dr. Kale, who do we have here?
This is Felix.
What kind of cat?
Sphinx.
And
He's a
yours,
hairless
right?
cat. Yes.
Yeah. So Sphinx,
Yes.
hairless cat, and those are a little more rare in the cat world. And speaking of rare, you deal with all kinds of animals.
Yes, from scales to tails. We
So
see them all.
my bearded dragon could have come here, the chinchilla could have come here, all of them. I want to make sure people understand that this is ER, not for your regular pet visits, but specifically for emergency situations.
Correct. We are a 24-hour-a-day emergency room. You do not have to have an appointment, and we will get you seen in our open concept hospital.
A lot of people might have the tendency to pick up the phone and call their veterinarian right away, and oftentimes that veterinarian will say, okay, that's kind of out of our moment. You probably need to deal with the ER. So make that phone call right away if you think it's an emergency situation.
Veterinary Emergency Group, this is Ann. How can I help you?
Hi, I think my dog Milo ate his toy.
Let me get one of our doctors on the line.
Because you are able to handle things like emergency surgery if you need it, but also to assess what's actually going on.
Yes, so if you have any concern, or if it's after hours, you can call and you'll speak to a veterinarian to get your questions answered, and we can triage, perform emergency surgeries. We also have on-site ultrasound and advanced diagnostics that can help us make rapid decisions.
Because I have a friend who, her dog, they couldn't figure it out. They kept trying to figure it out, and it got to the point where the dog got very lethargic, which showed you things were getting worse. Ended up in ER, and the ultrasound showed that every sock that they were missing was probably in that dog's intestinal tract, something you see often.
Yes, dogs and cats, critters in general, are notorious for eating things that they shouldn't. And some of the most common symptoms are not eating, vomiting, diarrhea, just not energetic.
And some of those things are common for a short while, but at what point should we just go, okay, this could be an emergency situation? Because they're smaller bodies, sometimes things that humans can deal with a lot longer can take off in a pet, and it can get bad.
Correct, and they tend to mask things for a bit longer, so any concern, We would rather provide peace of mind and get that addressed sooner rather than later.
But changes in behavior, pets sometimes are creatures of habit, and so things like what would you look at and go, are you okay?
Right, hiding, reclusive, or shying away from touch or being picked up, if those are things they generally enjoy. Not eating, and then GI signs like diarrhea, vomiting.
When you say not eating, take them at their word for it when they're
Yes.
not eating, because sometimes people think, oh, I'll just give them the extra treat that I know they love, and even when they don't even want that, there's
Yes.
probably something wrong. With the open floor concept, it means you can get to things a lot quicker, but what is it like for you as a veterinarian to be able to have that pet owner with their pet, and what do you think it does for the pet who might not understand really what's happening?
I think that's one of the most unique things about what we're able to provide is the enhanced experience for the pet and the family, as well as us as the providers. You're involved in every step of the process. To make a change to the plan, time to decide on a different diagnostic, you're stepping in tandem with us.
The thing is that when a pet is sometimes taken away in the back room, all you do is pace the floor and you're worried, right?
Right.
And so when you're there the entire time, then you can see what's happening and you're walking us through it. So it does a lot for both parties, especially when pets can be pretty skittish, right?
Yes, and I think the transparency piece really allows us to all three parties communicate, because you know your pet the best, and us being able to verbalize that and then listen to them too is all part of the process.
All right, lastly, what made you decide to become a veterinarian?
I loved animals ever since I was very young. The human-animal bond is very indescribable. It's a special connection. Yeah. So being able to help families and their pets is why I'm here.
Yeah, plus the pets don't talk back, or do they?
Depends on who's listening.
Thank you, Dr. Kale.
Yeah, thank you.
Bye. I'm gonna go back and find, where's that little dog I had earlier? I'm gonna see if I can talk him out of letting me take that dog home. VEG ER for Pets has multiple Houston area locations. You can contact the one closest to you using the number right there on your screen, or visit veg.com. That's veg.com. That's a number that you should probably have close just in case you come across an emergency. And remember, this is just for emergencies. It's not just for your routine veterinary care. To find a location near you, veg.com.